now present For the Record.
Just ahead, a one-time only face-off of Wisconsin's governor candidates, plus the crisis for doctors making tough medical choices for complicated pregnancies in a post-Roe world.
But is it the life of the mother or the health of the mother?
And a crisis of EMS services in Wisconsin, now heading to almost 24 referendums.
We have people that I've talked to personally that have worked 600 hours in a month.
Welcome to For the Record. I'm Naomi Kowles. More than 3 months after the Supreme Court overturned Roe v. Wade, the situation for doctors in Wisconsin remains complex. In the world of our state's near total abortion ban from 1849, they would be on the hook for charges if they provided an abortion that a prosecutor deemed was not life-saving care. I sat down with the Wisconsin Medical Society's president, Dr. Wendy Molaska, about how that's playing out in hospitals around Wisconsin. Paint me a picture of what the more than 3 months now since Roe v. Wade was overturned has looked like in Wisconsin for doctors.
It's been a very complicated 3 months, I would say, is that as physicians throughout the state, we've been trying to figure out, what are we still allowed to do? What are we not allowed to do? Where are the black and white areas? Where are the gray areas when we talk about reproductive health care and in particular abortion? So is it okay to provide an ectopic pregnancy termination because that's not going to be a viable pregnancy in the long run anyway? Is it okay that if a fetus does not have a heartbeat anymore, but the woman isn't miscarrying on her own, that we can provide treatment, either medical or surgical, so because this again isn't going to result in a live birth. So there's been a lot of these questions, and then trying to figure out how to best help our patients who are seeking abortion, where we're like, well, under our belief that we're under the 1849, 1858 bans, what do we do in these situations in terms of sending patients to other states, or what we need to do there? So it's been really kind of difficult, I think, trying to navigate this, and it's such a moving target as well as we go through and contemplate all the different outcomes.
What are the stories you're hearing, the specific stories you're hearing from doctors around the state right now?
Oh, we're hearing so many different stories, and I think the ones that, personally get to me, so I previously practiced in a rural area in Wisconsin, and I really feel for the physicians in rural Wisconsin because they already have issues with access for a lot of their patients, and now they're having even more problems with access because if they can't easily provide a full range of reproductive health, where do they go, and where do they, where is that line where they're waiting until the life of the mother is at risk versus the health of a mother? Is
there any call or complication in particular that's kind of stuck with you?
I think the biggest ones that have stuck with me, and this is personally from some patients, is how they are contemplating going about their own pregnancies, how they're concerned that if they get pregnant and they have an ectopic pregnancy, what are they going to do? If they have a fetus that isn't viable, if they have a fetus who, there's one woman in particular who is what we consider advanced maternal age, so she's like 39 years old and doesn't have a lot of reproductive years left, and she is also then more at risk for having babies with various anomalies. So if she has a baby that has an anomaly like trisomy 18, which is not compatible with life, although many of these babies can be born alive, they just won't survive very long. She's like, I don't have a lot of years left. If I were able to find out in the first, second trimester that I have a baby with one of these fatal anomalies, I could get an abortion so that I can then wait a couple months, get pregnant again. Right now, what it would be is, no, you can't get an abortion. You have to carry out that entire pregnancy, have a baby that, isn't going to survive before you can get pregnant again. And so she's really concerned about, I don't have a lot of childbearing time left. How is this going to affect me? So this is, some of the, concerns that we're seeing from patients.
There's been some kind of striking stories we've heard from, say, other states, whether it concerns very young girls who are needing abortions, who either can't get them or have to travel out of state, or mothers whose care is delayed because of the gray area, because of the confusion, leading to a worse complication. Are we seeing that in Wisconsin?
Well, I think we're seeing a lot of these different possibilities here. So very young women who get pregnant are at much higher risk of complications related to pregnancy, but is that their life at risk or their health at risk? women who are diagnosed with cancer while they're pregnant. There's been concern, well, can I treat them with the chemotherapy that they need to help with their cancer, knowing that that might cause a miscarriage or an abortion? And so, you know, we want to save the life of the mother, but is it the life of the mother or the health of the mother? And that's where this big gray area is who's to determine where that life of the mother versus the health of the mother is. The other thing that we see, that we've been seeing a little bit of lately is also like rheumatologists being concerned about not being able to prescribe medications like methotrexate to their women who have lupus and rheumatoid arthritis, especially if they're of childbearing age, because this is considered one of the abortion pills. Well, this is also a very commonly prescribed pill for treatment of these diseases. So all of a sudden, are we not able to treat women for these other serious conditions because of the risk of potential miscarriage and abortion?
Let's talk policy, law, and politics real quick before we wrap up.
Sure.
If you had to advocate for a specific set of laws in Wisconsin, would it be to simply revert to Roe v. Wade in place, but the other restrictions that state laws, Wisconsin state law had, whether, no abortions after 20 weeks or whatnot? Or is there some other more ideal set of laws that you would advocate for?
Yeah, so I think, so within the Wisconsin Medical Society, basically our policy is that what we really worry about with the fact that this 1849 law looks like it's in effect right now is that interruption of the doctor-patient relationship. And so as we look forward in terms of creating laws, we want laws that are fair to help keep the doctor-patient relationship intact, to make sure that we can talk about and provide evidence-based medicine for our patients when they need it. And so what does that look like? It definitely should include abortion care. The policy also states so, and this is one thing I like to emphasize as well, is that if you as a physician or a caretaker don't believe in abortion and have different reasons that you don't want to do it, our policy doesn't say you have to do it. But we should have providers that are able to do this because it is evidence-based and there are good evidence to support why we need abortion as part of reproductive health care. In terms of the exact statutes that I'd like to see, there's myself personally, and then there's, kind of where we are as a medical society. And I think, again, what we'd rather support is having some kind of, access to abortion for all women of childbearing age who need it when they need it. What that looks like with restrictions, again, is a little bit hard to say because, again, it comes into that doctor-patient relationship. I would like to see, the broadest possible legislation to allow the full reproductive health care rights. And some of this, too, I say, things change over time. The law that we're looking at from 1849 was before the germ theory. So doctors used to go from dissecting cadavers over to delivering babies without washing their hands because they didn't understand germ theory. And then they wondered why all their moms and babies were dying because they were infected with all these germs from these dead bodies their hands were just in. So things change over time. And while we might say that, back in 1849, this was reasonable, in this day and age, knowing what we know, it's not.
Doctor, thank you so much for your time. I appreciate it.
Yeah, thanks, Naomi. Thanks for having me.
When we come back, a look at the highlights of Wisconsin's only governor's debate.